Hi everyone, my name is Mary Kate. I have prepared for you an active learning demonstration on how to administer insulin. This demonstration involves the psychomotor domain and it is intended for nursing students or new diabetics. The objective is to complete a simulated learning experience on insulin administration. Simulated learning helps develop skills in a controlled environment while developing critical thinking skills, clinical judgment, and enhancing decision making. So since this is a simulated learning experience, we'll be injecting an orange, not a real person. We will also need to know what the order for insulin is. You'll need some alcohol swabs, your insulin vial, and an insulin syringe. Now this is just saline, but it's good to practice on. So a couple of things you'll need to know before you do this is what the order is and what the blood sugar is. So let's say the blood sugar is 60 and the insulin orders for 7 units of long-acting insulin. We don't want to administer that insulin because the blood sugar is too low. So instead of administering the insulin, you'll say you'll have the patient eat at least 15 grams of carbohydrates instead and then eat breakfast. If it's the next day the blood sugar is 205, the order is to give 5 units of the long-acting insulin. This would be a good time to administer that insulin. Of course, you want to do it at meal times, even though the long-acting insulin doesn't have a peak. It's still good to give with meals. You don't want to give it if you're not eating, if you're sick, you're nauseous, because the sugars can drop. So let's proceed by wiping off the insulin vial with some alcohol. So you want to do this for a few seconds to make sure everything's clean. And since this is a multi-dose vial, we are going to want to make sure that the expiration date's good. If it's open for more than 30 days, it's going to have to be refrigerated. So at the hospital, we tend not to refrigerate, but at home, it's going to take a long time to go through this. And so you'll want to refrigerate it if you're a diabetic at home. So the order was to give 5 units, so we'll put the plunger on 5 units, and I have it on 5 units here. And then we'll take the cap off, and we'll put it right in the center of the vial, and you'll inject it in, just the air, and then you pull back to the 5 units. You'll look, and if you're in the hospital setting, you'll want to swoop up the cap like this before you go walk into your patient's room and give it. If you're at home, you'll just go ahead and administer right into where it needs to go. So use another alcohol swab and we'll find our spot. So you could do this in many places, anywhere on the stomach or under the arm is usually where we do it in the hospital setting. So let's say this is the patient's stomach. We'll want to do it at least 2 inches away from the belly button. So if this is the belly button, we'll do it about right here. So you're going to want to swab for about 10 seconds. That's going to prevent infection. And you just do that, leave it here. A tip that I give to nursing students is to leave the syringe leave the alcohol swab on and point the corner to where you wiped your site. So this is where I wiped, so this is where I'll inject. It's a nice little landmark. So you'll take the cap off your insulin, and we'll go ahead and inject right here at a 90-degree angle. And there you go. Withdraw. Now you're going to want to know the syringe's safety device, and for this one, you just pull it up right here until it clicks. If you're in the hospital, you'll put it in a Sharps container. If you're not, if you're at home, big laundry detergent containers work, or milk jugs. And then you'll take it to wherever your city disposes of needles. Sometimes it's police stations will do it. Sometimes it's pharmacies will take them. It just depends on where you live. So a few things you want to make note of when you're injecting. You don't want to inject in the same site more than once. It'll cause lipodystrophy, and that it'll be hard skin, and then insulin won't absorb as well. Yeah, another thing is, like I said before, make sure the insulin's not expired. Make sure you're using the alcohol, and hold your syringe correctly. And yeah, so that was the presentation. I hope you have developed your clinical skills, and have a great day.